Play. Okay, page number 14. കിട്ടിയോ? City Clinic.
കേട്ടു സാറേ.
Please start preparing.
Yes, sir.
Okay, that's 3 minutes. Please start speaking.
Hi, I am Nili, one of the registered nurses working here in the city clinic. How can I help you today?
Actually, I came with my daughter, and the doctor has asked me to get a urine sample for check, and I need a container or something to collect the sample.
Sure, definitely I can help you for the procedure and I can understand your concern as a parent as your child is experiencing this urinary tract infection. Before
Right.
we proceed any further, I would like to ask you some questions
Okay.
for the documentation purpose. Is that all right?
Yes.
When did she start the symptoms?
It's been a couple of weeks.
Did she experience any pain?
Not pain particularly.
Did you notice any other symptoms associated with this?
No.
Is she hesitant to urinate frequently?
Yeah, her she urinates normally actually,
All right.
but sometimes it's
Now,
difficult. We can't
did she
monitor.
take adequate amount of water?
It's very difficult to make her drink water at all.
Yeah, it's really important to take ample amount of water.
Okay.
Did she experience any fever or any headache?
No.
All right. Now, do you have any idea regarding this urine sample collection?
Yeah, I think I just have to collect it and take it. Do I have to follow any other instructions?
Yeah, definitely. I will tell you, I will explain to you regarding the process of urine collection.
Okay.
Initially, you need to make your daughter to drink plenty of water. This will help to fill up her bladder and she feels to urinate. And once she started to urinate, you need to collect the midstream urine. And it is very important that you should not contaminate the urine bottle. If it is contaminated, it may it may result in it may lead to false results, or we may not exactly identify the actual reason for the urinary tract infection. Do you understand?
Okay.
Do
I'll
you have
uh,
any other
for
questions?
I'll follow your instructions. And when do I have to take it? And quickly, how quickly I need to take it to the doctor for checkup?
Yeah, I will explain to you that the next procedure what we are following is after the urine collection, we will take the sample to the laboratory within 12 hours. And initially from the lab, they will perform a dipstick test, and afterwards, if it is needed, they will perform a full lab analysis. Am I clear to you?
Yeah, but I don't know whether her problem will be fixed soon. It sounds like it will take such a long time.
Yeah, it depends on the test result. The doctor will give you the information regarding how long it will take and what are the things you need to carry out.
Okay.
Is that clear?
All
And
right.
also, do you have any idea regarding what are the causes for this urinary tract infection among children?
Maybe lack of drinking water. Am I right?
Yeah, definitely it's a reason for urinary tract infection among children.
Okay.
Yeah, I can give you some more information regarding the causes of urinary tract infection in children. It is
Okay.
common among children, and the various reasons for the occurrence is usually the children are very hesitant to pass urine, and moreover, the other reason is lack of drinking adequate amount of water. These are the two major reasons which result in urinary tract infection in children.
Okay.
Did the doctor explain to you regarding what are the instructions you need to follow at your home?
Yeah, kind of.
Yeah, I can explain to you once again regarding what are the things you need to
Okay.
follow in your home to take
Five
care of your
minutes.
daughter.
5 minutes. Thank you.
Okay, thank you very much for your cooperation. Thank you.
Okay. എങ്ങനെ ഉണ്ടായിരുന്നു? കൺഫ്യൂഷൻ വല്ലതും ഉണ്ടായിരുന്നോ?
അല്ല ഇത് ഈ സാമ്പിൾ സെൻഡ് ചെയ്യേണ്ടത് അത് എങ്ങനെയായിരുന്നു 12 hours അത് നമ്മൾ എങ്ങനെ സെൻഡ് ചെയ്യാൻ ഉദ്ദേശിക്കുന്നത് മൂന്നാമത്തെ ടാസ്ക്
Okay. Ask how പേഷ്യൻറ്റിൻ്റെ ഇത് ടാസ്ക് ഇതാണ്. Ask how quickly you need to bring the urine sample to the clinic. Okay. Outline the next steps after sample collection. Taken to the clinic within 12 hours. Initial dipstick test. Okay. Collect the urine. Within 12 hours, you should get it to the clinic. They will first do a dipstick test, and then they will do a full lab analysis if required based on the first test. Clear or no?
Ah,
അത് 12 മണിക്കൂറിനകം കൊണ്ടു കൊടുക്കുക,
ah,
സാമ്പിൾ കളക്ട് ചെയ്തിട്ട്.
ah,
അത് കഴിഞ്ഞിട്ട് ഡിപ്സ്റ്റിക് ടെസ്റ്റ് ചെയ്യും. അത് കഴിഞ്ഞിട്ട് ആവശ്യമുണ്ടെങ്കിൽ ഫുൾ ലാബ് അനാലിസിസിലോട്ട് പോകും ബേസ്ഡ് ഓൺ ദിസ് ഈ
ah,
ടെസ്റ്റിൻ്റെ റിസൾട്ടിനനുസരിച്ച്. ക്ലിയർ അല്ലേ?
ah, ah, clear.
ഓക്കെ. Now let's go to another task. സോ ക്രൈറ്റീരിയ ഒക്കെ വന്നിട്ടില്ലേ? ഇൻഫർമേഷൻ ഗ്യാതറിങ്, ഗിവിങ്, കളക്ടിങ്. നോ പ്രോബ്ലം.
Ah. ഇതിന്റെ ബാക്കിയും കൂടി ചെയ്താലോ സാറേ?
അതിൻ്റെ ബാക്കി ഓക്കെ. കെൻ യു ഫിനിഷ് ഇറ്റ് ദെൻ?
Yes. I can also explain to you regarding what are the things you need to carry out at home to taking care of your child. It is important to maintain strict hygiene for your child. Also, you need to make sure to wear cotton underwears, and it is important to avoid the use of unscented or unperfumed products for your child. Is it clear?
ഓക്കെ.
And also, I can tell you that the children were usually reluctant to use toilet during the time they spend at the nursery. It is common. It is a common phase among children, and usually they will grow out of it when they become accustomed to teachers and school environment. So there is nothing to be overly concerned regarding that. I
ഓക്കെ.
can also tell you that it is very important to make your child well hydrated. So make sure to drink ample amount of water. For this, you can consider fruit and ice blocks. So this will motivate them to take plenty of water. Do you understand?
ഓക്കെ.
Is there anything that I need to clarify?
നോ താങ്ക് യു.
Okay, thank you very much for your participation.
Great, that's good. Let's go to the next one. That we had done next. Okay, page number 16. Hospital ward.
Hospital one.
Yes. Okay, start speaking, please.
Hi, I am Lily, one of the registered nurses working here in this hospital ward. How are you feeling today?
I'm alright, thanks.
Okay. Can you please tell me your name for the confirmation, please?
My name is John.
All right, John. John, from your reports, I understand that you are suffering with a bone infection in your leg. Is that correct?
Yes, unfortunately.
Don't worry, John. Definitely, you are at the right place, and we will help you to manage your condition. And I am here to monitor your bone and also to check your vital signs and monitoring your intravenous fluid.
Okay.
Do you have any idea regarding what are the symptoms of this bone infection?
No.
Yeah, definitely, I can explain to you. Usually, the people with this kind of infection will experience some sort of fever and pain. But in your case, your condition is progressing because your temperature is normal and it shows the positive effect of antibiotics. Do you understand?
Okay.
In order to understand your condition in a better way, I would like to ask you some questions related to your pain. Is
Go
that
ahead.
all right?
Go ahead and ask me.
Do you have any pain at present?
Yeah, I have. I have actually. In fact, I'm in lot of pain.
Okay, on a pain scale of 1 to 10, 1 being the least and 10 being the highest level of pain. What's your pain score?
Maybe six.
Okay, I'm sorry to hear that you are having severe pain. And is there any change in your level of pain?
It it's been constant. I do not notice any change.
Okay. Is there any change in the location of your pain?
I don't know why you are asking me all these questions.
Yeah, I will explain to you the reason behind that. Before that, can I ask you one more question?
Okay.
Are you experiencing any pain in any new location?
No.
Yeah, now I will answer to your question. Why
Okay.
I am exploring the changes in your pain is it is very important to monitor
Change.
the changes in
Why?
pains because
Why am?
change in
Okay. Why I am exploring the changes in your position is that connect another that which is that.
uh,
Yes.
why I am exploring the changes in your position of pain is that it is important to monitor the signs of any secondary infection. If you are experiencing pain in different places, it may give an indication to secondary infection. Do you understand?
Okay. Okay.
Mr. John, it is very important to inform us that if you are experiencing any changes in pain, will you able to do that?
I can do that.
Oh, thank you very much for your cooperation.
Hmm.
Do you have any other questions related to your condition?
What about my medication?
Okay, definitely, I will explain to you regarding the medication. The treatment plan which we are following in the hospital is before your discharge, we
Hospital
need to
is
control
that
your
same mistake.
hospital is hospital is that first of all we need to control the infection and we need to switch the IV antibiotics to oral antibiotics and moreover you need to establish a self medication routine. Is it clear for you?
Okay.
I can also explain to you regarding the antibiotic treatment plan. You need to continue intravenous antibiotics for a few more days in the hospital, and after which, for 6 to 8 weeks, you need to take this antibiotics in the tablet form at home. Is it clear?
Yeah, but I'd want you to give me in an oral form or something instead of giving me a drip. If you just give me medication in oral form or tablet form, I can just go home today itself.
But Mr. John, I can really understand your concern, but it is important to control your infection For controlling your infection, the IV antibiotics are very essential in the initial stages.
How long
Once
do I
your
have to
infection,
take the antibiotics?
in the IV antibiotics, you need to take 1 more week.
Okay.
After which, we will convert into tablet form for 4 to 6 weeks.
Okay. Thank you. Five
Do you
minutes.
understand?
Yes.
Okay, thank you very much for your cooperation. Thank you.
You will have to stay back at the hospital for a few more days, not few more days. Few is negative.
Uh, you will have to.
Stay back at the hospital for a few more days. Okay. കുറച്ച്
Uh,
പറയുമ്പോൾ
uh,
a few more days. All right. Um, that's good. You have any questions?
yes,
Did
sir.
you do well? ആ കണക്ടർ നമ്മൾ മറക്കില്ല
കുഴപ്പമില്ലായിരുന്നു.
കേട്ടോ.
ആ, അത്
That
ഒന്നും കൂടെ പറഞ്ഞു സാറേ.
the reason for administering medication is that കണ്ടോ മെഡിക്കേഷൻ എന്ന് പറഞ്ഞിട്ട്
ആ,
കണക്ടർ ഇല്ലാതെ അവിടെ എടുക്കാൻ പറ്റത്തില്ല.
ആ,
Okay, page number 17, private clinic.
yes, sir.
Okay, that's 3 minutes. Please start speaking.
Hi, I am Nili, one of the registered nurses working here in this private clinic. How can I help you today?
Actually, I'm experiencing a lot of fatigue and My feet is aching all the time. If you could help me, it would be great.
I'm really sorry to hear that you are experiencing this pain, but
Thanks.
sure, don't worry. Certainly, I can help you with this, help you to manage your problem.
Okay.
Before we proceed any further, I would like to collect some information for the documentation purpose. Is that all right?
Certainly.
Can you please tell me your name?
My name is John.
What's your age?
I am 52.
Do you work?
Yes, I work as a customer representative.
Do you get rest in between your work?
Not really. I have to stand for long hours.
Do you have pain at present?
Yes, a lot of pain.
I'm really sorry to hear that. What type of pain is it?
I feel kind of tingling, numbness. More than pain, it's kind of disabled feeling, like numbness feeling.
Okay, I'm really sorry. We will definitely help you to manage your condition.
Hmm.
Do you stand for a long time at your working time?
Yes, as I have explained before, I have to stand for a long time.
Yeah, all right. Definitely, we will help you to manage your condition. And
Yes.
from your explanation, I came to know that the reason for your tiredness and pain is due to the long working hours, and also this and the stress you may experience due to your poor memory.
Okay.
Now, I can suggest you some of the initial steps you can follow to improve
ആ
your
അതൊ-
issues, to
അതൊന്നുകൂടെ
improve your
പറഞ്ഞേ.
problem.
അതൊന്നുകൂടെ പറഞ്ഞേ.
Sorry.
ഇപ്പൊ പറഞ്ഞ ടാസ്ക്.
Yeah, from your explanation, from our discussion, I understand that the problem, the problems you are, the reason for your problems you are experiencing, such as tiredness and poor memory, is due to
No,
long working
I
hours and
didn't
stress.
say. I didn't say I have poor memory. Did I?
I'm sorry.
Okay. So
Do you
yes.
do you
So
experience any difficulty in recollecting things or
yeah.
any memory problems?
അത് പറയുന്നപ്പം അങ്ങനെ ചോദിച്ച് അവരെ കൊണ്ട് പറയിപ്പിച്ചിട്ട് പറയണം, അല്ലാതെ യു കനോട്ട് ഔട്ട് ഓഫ് ദ ബ്ലൂ സേ ദാറ്റ് യു ഹാവ് മെമ്മറി പ്രോബ്ലം. Yeah, okay.
Sorry.
Yes, in fact, my memory is not good nowadays, and when I am stressed, even my hands shake.
All right.
Hmm.
From our discussion, I came to know that the reason for your problems you are experiencing, such as tiredness and poor memory, related to your long working hours and stress. Do you understand?
Yeah, sometimes I don't. I'm not able to manage things at all. I have plenty of things to remember. I can't write them down always. What should I do?
Don't worry, definitely we will help you. Now, I will explain what are the initial steps we can take to improve your feet issues. Can I proceed with that?
Now I will explain about the initial. Explain what are the initial steps. അതിൻ്റെ ഇടയ്ക്ക് ക്വസ്റ്റ്യൻ ആയി പോവല്ലോ.
Uh,
Now
Now,
I
I
will
will
explain
explain
some of the
the
initial
initial
steps.
steps. Uh,
Okay, എന്നൂടെ പറഞ്ഞുതരാം. Now I will explain
uh,
what are the initial steps എന്നല്ല. Now I will explain
uh,
what the initial steps are. What are the initial
uh,
steps ക്വസ്റ്റ്യൻ ആണ്. ഹെൽപ്പിംഗ് വേർബ് എടുത്ത് ലാസ്റ്റിൽ
uh,
ഇടണം, ആൻസർ ആയിട്ട് വരണമെങ്കിൽ.
uh,
Now I will explain
uh,
what the initial procedures are. കണ്ടോ?
mm,
Okay.
mm.
Do it again.
Now, I will explain initial what the initial steps are.
Okay. Yes.
What the initial steps you need to do to improve your feet issues.
Okay.
First of all, you need to wear a comfortable shoes. Will you able to do that?
A comfortable shoes അല്ല, you need to wear comfortable shoes. ഒരു ഷൂ അല്ലല്ലോ ഇടുന്നത്.
We need to wear we need to wear comfortable shoes.
Okay.
Secondly, you can consider for orthopedic shoes along with compression stockings.
All
Do you
right.
understand?
Okay. Continue.
But I can also tell you that you may the problem excessive pain tingling sensation you are experiencing on your feet is because you may be putting too much pressure on
Is
yourself.
because അല്ല, probability ആണ്, could be because of.
Uh, because you may be putting too much pressure on yourself.
മനസ്സിലായത്? could be ആണ്, possibility ആണ്.
Uh,
If you're certain, you
uh,
can say is because of this, or it could be, or possibly. Okay.
mm.
Yeah, you're right. I undergo a lot of stress at work. I don't know what to do.
Okay, definitely we will help you with that. Initially, we will settle your food problems. Later on, we will discuss the points how you can manage your stress.
Okay.
Now, what I will do is I will just examine your
What I
food.
will do
If
is
there,
that connector.
what I will do is that I will examine your food for observing is there any change, is there any signs of infection, and if requires, based on the
I will
observation, I will
examine your
suggest
food to check whether there is like.
whether there is any signs of injury,
Hmm.
and based on my examination, if requires, I will suggest a consultation with podiatrist.
All
Is that
right.
clear?
Okay, that's good.
And moreover, for managing your memory problem, I can book an appointment with your general practitioner if you are willing.
Actually, the real reason why I'm here is that uh, I'm feeling extremely paranoid about the whole thing. I'm afraid I have some neurological disease. Maybe especially because of my family history, because I have some same background.
Yeah, I can understand your concern, but John, it is important to make appropriate diagnosis by consulting with a doctor. Please avoid self-diagnosing your condition and avoid overthinking regarding you are suffering a neurological problem. Is that clear?
Okay, if you say so.
Okay, do you have any other questions?
No. Okay,
Now,
let's
can I?
let's do this again.
Sorry.
We were all over the place. So now let's do it again. Manage the time also.
Uh,
Start.
Hi, I'm Millie, one of the registered nurses working here in this private clinic. How can I help you today?
Actually, I'm feeling a lot of tiredness, pain on my feet, and worse symptoms. If you can do something about it, it'll be great.
Yeah, I'm really sorry to hear that you are experiencing pain and other problems. Definitely, I can help you to manage your condition. Before we proceed any further, I would like to ask you some questions for my documentation purpose. Can I proceed with that?
Certainly.
Can you please tell me your name?
My name is John.
What's your age?
52.
Do you work?
Yes, I work full
What
time.
type what type of work you are doing?
I'm into accountants. I'm an accountant.
Do you have pain?
Yes, that's why I'm here.
Wha- What kind of pain is it?
It's more of how do you explain? I feel tingling all the time, uh, numbness on my leg, and pain as well.
Okay, on a pain scale of 1 to 10, 1 being the least and 10 being the highest, what's your pain score?
Pain wise, it may be 4.
All right. Do you get rest in between your working hours?
Um, that's not too often.
All right. Do you have any problem with your memory?
Yes, I do experience issues with my memory. I can't remember things. I don't know how to manage that on the top of this.
Okay. Did your work involves a lot of stress?
Repeat the question.
Did your work involve a lot of stress?
Are you asking past or present? Does
Both.
your work present? Does your work?
Does, does your work involve a lot of stress?
Yes, in fact, a lot. Actually, ഇവിടെ ഒത്തിരിയും ഇൻഫർമേഷൻ
Uh,
ഗ്യാതറിങ് ഒത്തിരി ഉണ്ട്. മാത്രമല്ല നമുക്ക് അത് തന്നേക്കുന്ന ഹെഡിങ് ഉണ്ടല്ലോ.
uh,
You can use that also for information gathering. This patient has family history of issues.
schizophrenia.
Yeah, you
Uh,
can ask. You can ask that also. Do you have any family history of such
do
kind
you
of
have
disease?
any family history of multiple sclerosis or Parkinson's disease?
Yeah, actually, my uncle and when my aunt also had the same problem.
Okay, from our discussion, I understand
അപ്പോൾ
that the
this
reason.
information gathering കുറച്ചുകൂടെ ഇവിടെ ഒത്തിരി ഉണ്ട്. You won't be able to finish the task if you go at this pace. You have to do faster.
Mm,
1, 2, 3, 4.
mm,
Okay, let's do it again.
okay.
ഇപ്പം അത് ചെയ്തപ്പോഴത്തേന് 3.5 minutes ചെയ്തു. ടാസ്ക് 1 അല്ല ആയല്ലോ.
Um,
ടാസ്ക് 1 ഫിനിഷ് പോലും
അതെ.
ചെയ്തില്ല. സോ യു കാൻ
Mm,
ടേക്ക് ദാറ്റ് ലോങ്. ഇൻഫർമേഷൻ ഗ്യാതറിംഗ് ഉള്ളപ്പം പെട്ടെന്ന്
um,
പെട്ടെന്ന് ചെയ്യണം. യു ഹാവ് ടു സീ.
mm.
ഓക്കെ, പെട്ടെന്ന് ചെയ്തേ. സ്റ്റാർട്ട്.
Hi, I'm Millie, one of the registered nurses working here in this private clinic. How can I help you today?
Actually, I'm experiencing a lot of pain at my leg area, and I'm struggling with some memory issues as well. If you could help me, be great.
Yeah, definitely I will help you with that. Before we proceed any further, I would like to collect some information for the documentation purpose. Is that all right?
Sure.
Can you please tell me your name,
John,
your age?
52.
Do you have pain?
Yes, well, I'm here.
Do you experience pain all the time?
Yes, most of the times, and it gets worse during nights and in the evenings.
All right.
അവിടുത്തെ
Do you
ക്വസ്റ്റ്യൻ
work?
ഡു യു ഹാവ് പെയിൻ എന്നല്ല, ഡു യു ഹാവ് പെയിൻ റൈറ്റ് നൗ എന്ന് ചോദിക്കണമായിരുന്നു. ഓൾറെഡി അയാൾ പറഞ്ഞു എനിക്ക് പെയിൻ ഉണ്ടെന്ന്. അപ്പോൾ അവിടെ സ്പെസിഫിക് ആയിട്ട് ചോദിക്കണം, ഡു യു
Uh,
ഹാവ് പെയിൻ റൈറ്റ് നൗ. ഓക്കെ,
uh,
വാട്ട്സ് യുവർ പ്രൊഫഷൻ?
do you work?
നീ വർക്ക്
What's your
ചെയ്യുന്നതിനുള്ളതിനെ
profession?
ഒക്കെ എല്ലാം നല്ലതാണ്. വാട്ട്സ് യുവർ പ്രൊഫഷൻ?
Uh,
ഐ എം എൻ അക്കൗണ്ടന്റ്.
do you get rest periods in between your work?
That's very rare.
Does your work involve a lot of stress?
Yes, in fact.
Do you have any memory issues?
See, you have to listen to the patient. In the beginning ഞാൻ പറഞ്ഞില്ലേ മെമ്മറി ഇഷ്യൂ
അപ്പൊ
ഉണ്ടെന്ന്.
അതൊന്നുകൂടെ ചോദിക്കണ്ട.
യു ഷുഡിൻറ്റ്. ഒരാൾ പറയുന്ന കാര്യം
Okay.
മിണ്ടണ്ടെന്ന് ചോദിക്കാൻ പാടുണ്ടോ?
ആയിക്കോട്ടെ, ആയിക്കോട്ടെ.
Yes. So you have to really
Is there
listen
any
to the.
family?
Really. Okay, let's start again. Don't
Okay, sir.
repetition shouldn't be there. അപ്പോൾ ഇവിടെ ഇൻഫർമേഷൻ ഗ്യാതറിങ് ഒത്തിരിയും ചെയ്യില്ല. യു വോണ്ട് ബി ഏബിൾ ടു ഡു ദ റെസ്റ്റ്. ഓക്കെ, പെട്ടെന്ന് പെട്ടെന്ന്
Yes,
ചെയ്തു
sir.
പോവാം. സ്റ്റാർട്ട്.
Hi, I'm Millie, one of the registered nurses working here in this private clinic. How can I help you today?
Actually, I'm struggling from pain on my feet, and also I have some memory issues. If you could help me, it would be great.
Definitely, I will help you. Before we proceed any further, I would like to ask you some questions for my documentation purpose. Is
Certainly.
that all right?
Yes.
Can you please tell me your name?
My name is Mark.
Do you, what's your age?
I'm 52.
Do you have pain right now?
Yes, I do.
Do you experience pain all the time?
Not all the time, especially it starts in the evenings and it gets worse at night.
What kind of profession is yours?
I'm an accountant.
Do you get rest periods in between your work?
Very rarely.
Is there any family history of multiple sclerosis or Parkinson's disease?
Yes, my aunt had the same issues, but she died.
Do you have any memory issues?
Uh, yes, I do, as I mentioned before.
All right. From our discussion, I came to know that the reason for your issues mainly related to the long working hours and stress.
Could be related to.
Could be related to the long working hours and the stress you are experiencing during work.
What should I do?
Do you do you understand? Definitely, I will help you. We will find out what the exact reason for your problems and how we can manage it.
Okay.
Now I will explain to you regarding the initial steps what you can take to improve your feet issues. Can I proceed with that?
Improve issues with your foot. Okay.
Initially, you need to wear comfortable shoes and you can consider orthopedic shoes for this.
Okay.
And you can also consider compression stockings. It will provide it will provide a sense of comfort when you are at work.
Okay, I can do that.
Is that clear?
Yes.
Okay, now I can tell you that um, the problem you are experiencing may be related to the too much pressure you are putting on yourself because of your work stress and prolonged standing. Is that correct?
Maybe you could be right because I in fact go through a lot of stress.
All right.
Hmm.
Now, what I will do is I will examine your feet
What I will do is
to
that.
observe. I will do is that I will observe your foot
Okay.
or monitor any signs of injury,
For
and
monitoring,
based on my
illegal to
examination
monitor.
for monitoring for monitor
No,
any
for
any
കഴിഞ്ഞിട്ട്
signs of injury.
for
For
കഴിഞ്ഞിട്ട്
monitoring any signs
ing.
of injury, and
Okay.
based on my examination, if requires, I will suggest a visit to a podiatrist. Is that all right?
Okay, okay, that's not bad. I can do that. But the real reason why I'm here is that I feel paranoid, especially because I suspect that I'm having some neurological problems because my aunt died of multiple sclerosis and she had a Parkinson disease. It's all over in my family. I'm quite worried.
Mr. John, I can definitely understand your concern, but before addressing that, if your case for managing your memory problem, I can book an appointment with your general practitioner.
If you
Is that
require
all right?
Salla, if you require singular, Allah plural
Uh,
Allah, you one.
if you require, if you require, I can book an appointment with your general practitioner. Is that all right?
Okay, if that helps. I just want to get rid of
Okay,
this.
Mr. John. Regarding I can advise you that please try to avoid self-diagnosing and overthinking. If you are doing this, again, it will worsen your condition. So please try to avoid such kind of thinking and self-diagnosing. Will you able to do that?
You're right. Maybe I'm just taking too much, thoughts. I should just chill.
Now, can I proceed with observing your feet for any serious injury or any other problems?
Yes. Thank you. 5 minutes.
Okay, thank you very much. Thank you very much for your participation.
All right. So now please tell me what are the things you noticed?
ഇത് ഇച്ചിരി കൺഫ്യൂസ്ഡ് ആയിരുന്നു.
Mm-hmm.
അപ്പൊ എനിക്ക് ആദ്യത്തെ ഇൻഫർമേഷൻ ഗ്യാതറിംഗ് പ്രോപ്പറായിട്ട് ചെയ്യാൻ പറ്റിയില്ല.
Okay.
പിന്നെ
So
ഇങ്ങോട്ട് വന്നപ്പം ഇത് ഇച്ചിരി കൂടെ പറയായിരുന്നു, അങ്ങനെ നമുക്ക് അങ്ങനെ ഈസി ആയിട്ട് പറഞ്ഞു പോകാൻ പറ്റും. അങ്ങനെയല്ല, മുന്നേത്തെ ടാസ്ക് പോലെയല്ല, ഇച്ചിരി വ്യത്യാസം വരുന്നു ഇതിനകത്തെ ടാസ്കുകളൊക്കെ.
സോ ഇൻഫർമേഷൻ ഗ്യാതറിംഗ് ഒക്കെ ഒത്തിരി ഉണ്ടെങ്കിൽ പെട്ടെന്ന് പെട്ടെന്ന് ചെയ്തു പോകണം. 1 2 3 4 OET ലിസണിങ് ചെയ്യുമ്പോൾ കേട്ടിട്ടില്ലേ?
ആ.
സി യു ഹാവ് എനി ഫാമിലി ഹിസ്റ്ററി ഓഫ്
ഉം.
ഇഷ്യൂസ്? അതെല്ലാം റെലവൻ്റ് ആണ്.
അതെ.
ഓൾറൈറ്റ്. മേ ബി യു ആർ, അപ്പോൾ പോസിബിലിറ്റി പറയുമ്പോൾ യു ആർ എന്നല്ല, യു മേ ബി സഫറിങ് ഫ്രം ദിസ് ഇഷ്യൂ.
ആ.
ഇറ്റ് കുഡ് ബി ദിസ്, ദാറ്റ് കുഡ് ബി
Yeah.
ദാറ്റ്. പിന്നെ കണക്ട് ചെയ്യാൻ ദാറ്റ് പലയിടത്തും മിസ്സാകുന്നുണ്ട്.
ആ.
ഇറ്റ് കുഡ് ബി ദാറ്റ് അല്ലേ? ഇറ്റ്
ആ.
I
കുറച്ച്
want to
പ്രാവശ്യം കറക്റ്റ്
explain
ചെയ്യുമ്പോൾ
to you.
ചിലപ്പോൾ
I
മിസ്സാവും.
want to explain to you that this is not a great issue.
ആ.
ചെയ്യാതെ ചെയ്യുക. പിന്നെന്തോ, റെസ്റ്റ് ഈസ് ഫൈൻ. മാനേജ് ടൈം. ഒരു റോൾ പ്ലേ വായിക്കുമ്പോൾ നമുക്കറിയാം എത്ര വരുമെന്ന്. ഇൻഫർമേഷൻ ഗ്യാതറിംഗ് ഇതിനകത്ത് ഒത്തിരി വരുന്നുണ്ടോ. പിന്നെ ഡോണ്ട് മേക്ക്
ഉം.
അസംഷൻസ്. ഇതിൻ്റെ അകത്ത് നമുക്ക് ആ ഫസ്റ്റ് പാരഗ്രാഫിൽ തന്നിരിക്കുന്നു പേഷ്യൻ്റ് മെമ്മറി ഇഷ്യൂ ഉണ്ടെന്ന് പറഞ്ഞിട്ട് ഉടനെ യു ഹാവ് മെമ്മറി ഇഷ്യൂ എന്ന് പറയല്ലേ. ദിസ്
ആ.
ഈസ് എ ക്ലിനിക്, റൈറ്റ്?
ആ. അതെ.
You do not know the patient also. So
ആ.
അവരെയും
ആ.
കൊണ്ട് പറയിപ്പിക്കണം. ഡു യു സ്ട്രഗിൾ വിത്ത്
ആ.
എനി മെമ്മറി ഇഷ്യൂസ്? അപ്പോൾ അവർ പറഞ്ഞിട്ട് നമ്മൾ കൺഫേം ചെയ്യണം.
ആ.
ഓക്കെ.
ഈ അവസാനത്തെ ടാസ്ക് എങ്ങനെയായിരുന്നു സാറേ പറയണ്ടേ?
Highlight the importance of not self-diagnosing and thinking the worst. I understand that you may be feeling that this. Okay. I understand that you're worried, but let me stress the importance of not. How can we say? I understand that you're worried, but please do not do any self diagnosis. The issue may be not even related to that. So you can consult the doctor, and the doctor will find out the exact problem that you are facing. So, and do not worry too much. Things can become worse. Do you understand? Complicated, I don't know.
അത് ഞാൻ എങ്ങനെയാ പറഞ്ഞത്?
Okay.
അവോയ്ഡ് ഓവർ സെൽഫ്
Simply
ഡയഗ്നോസിങ് ആൻഡ്
പറഞ്ഞാൽ
ഓവർ തിങ്കിങ്.
simply പറഞ്ഞാൽ എങ്ങനെ പറയാൻ പറ്റും? It's very important that you do not do any self diagnosis and worry about that. Once you consult a doctor, the doctor will find out the exact cause for your issue.
ആ.
So
ആ.
thinking will not make things better but worse. Madhu,
ആ. മതി.
can you try that?
ആണോ? ആ സാറേ, ഇറ്റ് ഈസ് വെരി ഇമ്പോർട്ടൻറ്റ്. ഇറ്റ് ഈസ് വെരി ഇമ്പോർട്ടൻറ്റ് ദാറ്റ് യു it is very important that you avoid self-diagnosing and overthinking. Thinking
Okay.
will not make things better, it will make things worse.
Do you understand?
Do you understand?
Yeah, that's good. You did great. That's nice. വേറെ എന്തെങ്കിലും ഉണ്ടോ സംശയം? Do you have any other doubts or questions that you would like to ask me? Do you use these sentence formation and things at hospital?
No, sir.
Start using it. It will help your exam. Do you have any
ഇവിടെ പോയിട്ട്
questions or
ഇംഗ്ലീഷിൽ
doubts?
പറയണ്ടല്ലോ സാറേ.
എന്തോ?
ഇവിടെ പോയിട്ട് ഇംഗ്ലീഷിൽ പറയണ്ടല്ലോ.
Yeah, start using it. It'll become natural for you. All these things, dialogues. All right. വേറെ എന്തെങ്കിലും ഉണ്ടോ? I hope that I have explained everything in detail. Do you have any other questions or doubts that you would like to ask me? See, all these statements you can practice.
ആ സാറേ.
Yeah, it'll become normal. It's good if you practice all these type of standard statements. It'll give you a good flow, and when people
ആ.
assess your recording, they'll get a good impression. മനസ്സിലാകുന്നുണ്ടോ? See, ആ സ്റ്റേറ്റ്മെന്റ്സ് ഒക്കെ കണ്ടില്ലേ?
ആവുന്നു
I
സാർ.
hope that I have explained everything in detail, and I'd like to know if you have any more questions or doubts that you would like to discuss with me. കണ്ടോ എന്ത് നല്ല
ആ.
രസമാണ് കേൾക്കാൻ.
ആ.
അപ്പോൾ these things will attract good marks. എന്നാണ് എൻ്റെ
mm,
ഒരു
mm,
കാഴ്ചപ്പാട് തുടക്കം തന്നെ.
mm,
ഹായ്, ഐ എം
mm,
ലിനി, വൺ ഓഫ് ദ രജിസ്റ്റേർഡ് നഴ്സസ് വർക്കിംഗ് ഹിയർ ഇൻ ദിസ് സബർബൻ ക്ലിനിക്, ഹൗ ക്യാൻ ഐ ഹെൽപ്പ് യു ടുഡേ. കണ്ടോ എന്ത് രസമാണ്.
mm,
അപ്പോൾ അവിടെ
mm,
യു ഹാവ് ടു ബി കെയർഫുൾ, ഇതൊക്കെ ഡെവലപ്പ് ചെയ്യണം, ഗ്രീറ്റിങ്സ്
mm,
ഒക്കെ. അപ്പോൾ ഈ കേൾക്കുന്ന ആൾക്ക്
mm,
ഒരു ഇംപ്രഷൻ കിട്ടും, ഓക്കെ ദാറ്റ്സ് എ ഗുഡ്
mm,
കാൻഡിഡേറ്റ്, മോസ്റ്റ് പ്രോബ്ലി ദേ വിൽ ജസ്റ്റ് ഗിവ് യു ഗുഡ് മാർക്സ്. പക്ഷെ തുടക്കം
mm,
തന്നെ സ്ട്രഗിൾ ചെയ്യുമ്പോൾ തന്നെ അറിയാം. ഓക്കെ,
mm.
സോ യു ഹാവ് ടു ബി ഗുഡ് അറ്റ് ദ ഇൻട്രോസ്.
Yes, sir.
യെസ്, അതൊക്കെയാണ് എൻ്റെ സജഷൻസ്.
Ah,
ഓക്കെ,
sir.
all right, good job,
Oh,
and
okay, sir.
yeah, good going. Okay,
Okay, sir.
all right, all right. So exam is on 13th, right?
Started.
No. Okay, അപ്പോൾ I'll see you in the next class.
Okay, sir. Thank you.
Thank you. Good job.